This is really important. Anybody you know on chemotherapy, especially on aromatase inhibitors, and I'll tell you what they are. Let's go through this. Aromatase inhibitors are generally prescribed by oncologists to shrink breast tumors. Basically, they shrink breast tumors, especially if those breast tumors are fueled by estrogen. A good percentage of women that have breast cancer, that breast cancer is fed by estrogen. The more estrogen in your body, the more estrogen available to the tumor, the bigger the tumor gets. And when you use aromatase inhibitors, it can inhibit the formation of estrogen in the body, and it can help prevent the recurrence of the cancer, and it can shrink breast cancer, which is really terrific. Now, the treatment is very, very effective, but in many women, it creates all sorts of problems. Many women receiving this form of therapy have very, very severe joint and muscle pain. And medically, they just don't know what to do about it. In fact, there was a report, I'll read the first line here, high-dose vitamin D supplementation, there's the answer, may relieve muscle and joint pain for many breast cancer patients taking estrogen-lowering drugs. It says patients receiving a weekly dose of 50,000, that's a lot, international units, plus a daily dose of 400 international units on top of that, reported significantly less musculoskeletal pain and were also less likely to experience pain that interfered with their daily living while taking the aromatase inhibitors to shrink breast tumors. Now, aromatase inhibitors are very popular. I'll list the 5 or 6 most common. Arimidex, 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 Famara, Aromacin, Ribazor, Lenteron, and Afema. Those are the most common. Now, aromatase inhibitors basically inhibit something called aromatase, which is an enzyme that converts androgens into estrogen. In other words, aromatase creates more estrogen in your body. The more the estrogen, the bigger your tumor. So what these drugs do is they inhibit this enzyme that creates estrogen in your body. The problem is that it creates a tremendous amount of musculoskeletal pain in many women. But when you add this vitamin D to the mix, 50,000 units a week plus 400 additional units every single day, that pain goes away, and it allows the aromatase drug to be more effective, and it improves your quality of life. Now, whatever you do, do not attempt to do this on your own. So if you're taking one of those 6 drugs and you're having musculoskeletal pain, joint pain, don't just all of a sudden go out and start taking that much vitamin D. You should communicate with your oncologist and say, look, doctor, there's a new report out of Washington University School of Medicine. You can easily find it online. We reported it yesterday. And what you want to do is to have your doctor research that out and guide you. If your doctor can't do it, meet with a nutritionist that can at least communicate with your doctor about it. The lead doctor, by the way, that did this study at Washington University School of Medicine is a Dr. Antonella Rastelli, Rastelli, Antonella Rastelli. So the information is right there and available to you.